Access to healthcare services in Greater Minnesota is getting more and more difficult. Healthcare consolidation, hospital and clinic closures, and a global pandemic has made seeing a doctor or nurse harder than ever. Things become even harder if you don't have a car or can't drive. If you are disabled or elderly, what options do you have? Well, in Minnesota, an army of volunteer drivers has been saving the day in areas where public transit is either sporadic or non-existent. But studies and surveys have shown that, as the need for this vital service is rising, volunteer numbers have been dwindling. More than 2/3 of transit providers report that they do not have enough volunteer drivers to meet demand. In 8 years, the Southeastern Community Action Council went from 120 volunteer drivers to 70. United Community Action Partnership in southwestern Minnesota went from 130 to 65. Volunteer Services of Carleton County went from 100 volunteers to 40. Out of 28 volunteer transit providers surveyed, 23 had a hard time finding drivers, and 15 reported having to cancel rides due to the lack of volunteers. Only 5 organizations reported not having a shortage of drivers or forced cancellations. It's gotten so bad that many rides are just not scheduled in the first place. Several factors are contributing to the shrinking number of volunteer drivers. A low charitable mileage reimbursement, a lack of reimbursement for no-load miles, insurance and legal gray areas, and the regionalization of transit services in Greater Minnesota. Volunteer coordinators cite low mileage reimbursement rates as the largest contributor to the decrease of volunteer drivers. The federal tax code defines 2 types of mileage reimbursement: business rate and charitable rate. In 1985, the federal business mileage reimbursement rate was 21 cents per mile. The same year, the charitable rate was 12 cents. Over the years, the business rate has risen to 58 cents per mile in 2020. In 1986, the charitable rate was increased to 14 cents, where it has stayed ever since. And driver compensation is even harder to work with when the volunteer drivers themselves are on a limited Social Security income. That's right. Most of the drivers doing the driving are seniors themselves. A study of transit programs show that more than half of volunteer drivers are between the ages of 65 and 69. Most of the remaining half were nearing retirement or over the age of 69. For these volunteer seniors nearing or in retirement, these wages affect how much Social Security income they will receive. The fear of reduced Social Security money because of earning additional wages is a major disincentive for would-be volunteers, as most rely heavily on their fixed incomes. Volunteer drivers also have to deal with no-load miles. In rural Minnesota, the miles before pickup and after drop-off are a significant portion of any drive. Drivers may have to travel 30 to 90 minutes just to get to a client's home. But compensation for these miles are not guaranteed. The Minnesota Department of Human Services says that neither public nor private health insurers are required to cover no-load miles. The transit providers that do cover no-load miles usually pay for them using grants, local taxes, and donations. Volunteering to drive may raise the vehicle liability insurance rates for drivers. Recently, Minnesota wrote new laws for auto insurance coverage required for ride-sharing, like Uber and Lyft drivers. However, the language regarding ride-sharing programs was ambiguous enough that it could also be applied to volunteer drivers. The actual price of the insurance is left up to the individual insurance providers, which has resulted in some volunteer drivers paying more for the same insurance. Because of Greater Minnesota's low population density and the ever-increasing distances between rural hospitals due to closures and consolidations, drivers frequently travel over county borders to get a passenger to care. The confusion over which county-based transit provider was responsible for reimbursing the driver has led to a statewide emphasis favoring regional transit over county-based systems. So, between 2009 and 2017, the number of public transportation systems in Greater Minnesota went from 76 to only 40. While this has solved the reimbursement issues around crossing county lines, it did create some unforeseen consequences. For instance, the volunteer drivers in Roseau County on the Canadian border are coordinated through service offices in Crookston and Bemidji, both more than 2 hours away. With all these problems, it's tempting to consider giving up on volunteer driver programs. But data show that volunteer drivers actually save Greater Minnesota counties and insurance companies money. A study on 6 different volunteer transit programs across the state showed that all 6 saved money with volunteer drivers as opposed to taxis, special transportation services, or non-emergency medical transportation costs. Savings were from $75,000 annually to nearly $1.5 million annually. So what are the policy alternatives for this vital service? Our first option of scrapping volunteer drivers is only made worse by the difficulty of expanding regional public transit. Given the low population density and distances between homes and urban centers, building such an infrastructure would be tedious and expensive. MnDOT's 2019 transit plan states that it would take an investment of more than $159 million to meet 100% of transit needs. Given the cost savings and flexibility of volunteer drivers, a fixed transit system would not be feasible. One of the easiest options would be to increase the federal charitable mileage rate well above 14 cents a mile. But then you remember you'd have to go to Congress, and it's not really easy to get them to do anything. In 2013, a bill was introduced to bring the charitable rate up to the business rate. It failed to pass. In 2019, Congressman Colin Peterson and Pete Stauber proposed matching the business rate yet again. That legislation is still waiting to be heard in the House Ways and Means Committee. In spite of the uncertainty of dealing with Congress, this would likely be the most effective option for curbing the volunteer driver deficit. One way to attract more volunteer drivers would be for the state to reimburse organizations that pay for no-load miles. Because no-load miles are not covered by Medicare, Medicaid, or health insurance, reimbursing drivers increases the financial burden on local and regional transit organizations that do cover these miles. However, any state reimbursement above 14 cents would only increase the potential impact on Social Security income of volunteer drivers. Volunteers could save money on their car insurance if state law clearly defined the difference between rideshare drivers and charitable drivers. Accepting this policy should be relatively easy for the state legislature, as long as they are provided with a solid case for why charitable mileage reimbursement is different from contractual earnings due to rideshare. Because earned income may increase the amount of taxable Social Security benefits, the Minnesota legislature could expand existing laws to increase the minimum subtraction of taxable benefits, granting more wiggle room for the volunteers accruing earned income through the volunteer driver program. While expanding legislation passed in 2017 could help with the taxable income issue, the policy only addresses state income tax and is not targeted specifically toward volunteer drivers. It therefore may not succeed in incentivizing more people to participate in volunteer driving. One criticism of regionalizing transit services is the lack of community-based recruiting. MnDOT could help bridge this gap by actively recruiting volunteers while performing community feedback sessions. But increasing recruitment efforts are unlikely to restore volunteer driver numbers completely, as reimbursement issues remain the most important factor in dissuading individuals from volunteering. As the number of volunteer drivers fall and the number of elderly and disabled passengers increase, Greater Minnesota is in danger of losing one of its most important tools for healthcare and transit access. Volunteer drivers provide an essential transit service for some of our rural communities' largest and most vulnerable populations. Losing this army of volunteers will cost us more than just money, but will lead to diminished health and a worse quality of life. It is time to recalculate the route for our volunteer drivers toward a more promising destination. To learn more about the changing healthcare landscape in Greater Minnesota, visit the Center of Rural Policy and Development at ruralmn.org.